Now let's talk about treatment. Recently in the news, there was this exciting announcement that Plaquenil and Zithromax as a combination therapy is the likely treatment for COVID-19 infections. And I can say that I'm cautiously optimistic, but I'm not completely bought into it for several reasons. One, there's a certain process that has to happen in order for us to know whether or not a drug is truly effective. We know that studies done abroad have been done to look at this combination of therapies, but the studies have been very small, 36 patients in one study, 6 patients in another. So to base a universal treatment strategy on such a small number of patients is not appropriate. In public health and in medicine, that's not what we do. Historically, we do randomized controls, we get large numbers of people. In an emergency situation, we're not necessarily going to follow those steps, but it's important to have a clear understanding of what our expectations should be. That's sort of the ongoing theme of this update, is to have the right expectations. So we want to make sure that we're very cautious in the level of expectation that we have, because not only do we need to make sure that the treatment is effective across ages, across severity of conditions, we have to make sure that it also does not cause any side effects. If the treatment causes more side effects than the viral infection itself, then we have to take a pause to question whether or not this treatment modality is the most effective method of treating COVID-19 infection. The second thing that we have to keep in mind is that there's a specific timing in which the treatment should start. For Plaquenil, as an example, it helps to prevent the virus from entering into cells, which means it has to be given relatively early in the infectious cycle. But if we're not doing effective testing, we're not going to be able to pick up on it before it enters into the cells and causes more severe symptoms. So it becomes a very challenging approach when part of our challenge in terms of diagnosing is having a lack of access to testing kits. The other area of caution, particularly for Plaquenil, is that there are 3 reasons why I don't want people to bum rush their doctors to ask for Plaquenil prescriptions just in case. One, that's just not an appropriate way in which we approach treatment. We should not prescribe Plaquenil and Zithromax as a just-in-case way of managing the pandemic. 2, you don't want to rush to the pharmacy and create a shortage of Plaquenil for patients who critically need it. Plaquenil has not only been used as an anti-malarial drug. I think it's important, particularly here in the United States and across the world, to understand that Plaquenil is an essential medication for people who are dealing with connective tissue disorders and autoimmune disorders, rheumatoid arthritis, lupus, Sjogren's. Those in patients with those conditions, that medication is critical for them, not to just be treated, but truly to survive. In order for them to prevent flares and to risk their lives, they need to have that medication available. So just using the medication or writing for a prescription willy-nilly so that you have a bottle in your medicine cabinet is not appropriate. The other reason why it's not appropriate is that the medication can interact with other medications. So if your healthcare provider is prescribing the medication without truly vetting the other medications that you are taking, or if you're not vetting the other medications that you're taking, you're putting yourself at risk. And then thirdly, the reason why we don't want to just universally prescribe Plaquenil is that Plaquenil can exacerbate certain medical conditions, psoriasis being one of them. You also don't want to take Plaquenil if you have impaired liver or kidney function. So we don't want to just blindly prescribe medications that we have, 1, not completely vetted, 2, not explored in terms of side effects, and 3, not paid attention to in terms of general community use. The last thing I want to talk about is who is affected. Although we do have high-risk groups, our seniors, immunocompromised, and those with chronic diseases, it's important to understand that COVID-19 is an equal opportunity infector. We're seeing here in the States that up to close to 40% of patients who are hospitalized are between the ages of 20 and 54. And half of patients in the ICU are less than 60 years old. So I want to make sure that I'm clear in identifying high-risk groups, but having a clear understanding that all of us are at risk. What we're also seeing is that men are more adversely affected than women, particularly in terms of mortality. Men have a mortality rate twice that of women when it comes to death from COVID-19. That's some of the data that's coming out. And then one of the rays of light in this is that compared to respiratory infections like influenza, children have not necessarily been protected from it. We do see children infected, but in terms of mortality, children less at 9 years old or less, we have not yet lost a child to COVID-19. And I just pray that that continues to be something that I can report out. I want to say that before I end, I just want to commend you guys. I think out of this pandemic, out of this storm, I have appreciated such a cohesiveness, such a love of community, of our first responders, our healthcare providers, our government officials. There's been such an amazing amount of respect, particularly from a statewide standpoint. Our state officials, our county officials have really stepped up to the plate and provided such an amazing response to this pandemic. I mean, I've seen homeschool mommies they help us navigate the working mommies navigate through becoming teachers for our children. I've seen people come together collectively to serve our seniors, to make sure that they're well taken care of. And although we're going to have a select few people who violate the ordinances to stay at home, to not go to the tidal basin and appreciate the cherry blossoms, they will be there next year. But we're seeing people come together so well to love on each other, to share with each other, to be innovative in how we connect with each other. I just want to make sure that we just appreciate these moments. Like, we're starting to really learn that quality time at home. I can't tell you the last time I sat at home and just relaxed and did nothing. But I find that in order for me to have peace of mind in doing what I do to help in this pandemic, it has required me to even pause from social media, to really make sure that my mental health is taken care of, to make sure that it is prioritized, so that I have peace and rest as I go in to battle and fight this pandemic another day. And I see people putting out access to yoga classes, exercise classes, recipes, so that we maintain excellent physical, mental, spiritual, emotional, and relational health, even in the face of social distancing. So continue to encourage each other, love on each other, and I will be here again with more updates. Dr. Yola out.